Vaccines don't save life. Vaccination does. Because the best vaccines, if it's sitting on the shelf, has absolutely no effect. My name is Elizabeth Oduwole, and I'm a research officer and an EIDM specialist with Vaccines for Africa initiative, based at the University of Cape Town, and I'm working on the project called NISH. NITAG Support Hub, National Immunization Technical Advisory Board. Those are the group of experts that give advice to Ministry of Health, to governments on vaccines, introductions, and things like that. Before we get to misinformation and specifically online misinformation, just to clarify the terms, misinformation has been defined as information that is not true, that is just passed across or passed from one person to the other. Disinformation, on the other hand, is information that is not true, that is passed on with the deliberate intention to mislead the hearers. So, misinformation could just be a harmless rumor, and the proponents or the propagators of it may not even be aware that it's misinformation, probably because that's the level of knowledge available to them. But this information, somebody sits down to think it through and to deliberately put such information out there to, counter or to derail, to influence people's health behaviors. So that's the basic difference between misinformation and disinformation. Misinformation is wrong information haplessly passed around, in my layman's definition. But disinformation is wrong information deliberately passed across to influence people's health behavior, oftentimes negatively, actually negatively. If it's to influence them positively, then it wouldn't be disinformation. And then, of course, you would have heard of infodemic, which is just too much information flying at you. And the pandemic led to a deluge of information flooding everywhere, not just the online platform, even dinner tables, pub discussions, club discussions, schools, workplaces. The information was just everywhere. I had been working on vaccine hesitancy, vaccine confidence, way before I joined the NISH project. And actually my PhD dissertation was investigating drivers of vaccine hesitancy in the Cape Metropolitan District. And in that project, it was 3 parts. It's a 2-phased, 3-part project. The first phase, it's the evidence generation, and then the second phase is the primary studies. The percentage of people who agreed that vaccines is good for them was slightly lower than the percentage of people who agreed that vaccines is good for children. So that tells me that generally parents are happy to vaccinate children, but adult vaccination is, because COVID-19 brought adult vaccination to the fore. Usually adolescent vaccination, adults don't generally think of vaccination except they are traveling to some endemic areas, to some disease endemic areas like other parts of Africa where yellow fever is endemic and all that. That's when you see a full-grown man or a full-grown woman going for vaccination. But COVID-19 changed all that. The point-of-care vaccinators that I interviewed, those of them who had encountered vaccine-hesitant clients in the Cape Metropole, I interviewed at least one facility in all the 8 health districts that constitutes the Cape Metro or the Cape Metropolitan District. And the results, my result showed that religion was the leading driver of vaccine hesitancy in the Cape Metro. And it wasn't limited to a particular religion. Some told me about Muslim clients being reluctant. Others told me about Christian clients also being reluctant, that, we have prayed and we believe that prayers work. So vaccine hesitancy wasn't limited to a specific religion. Then it was routine childhood vaccination. It wasn't even COVID vaccination that we were interviewing. It was for the students and the lecturers that we included a question for COVID-19, of which majority of them, about 86%, if I'm not mistaken, said they will take a COVID-19 vaccine should one become available. Then the fear of AFIs. AFIs is adverse events following immunization. Religion, whatever religion it is, as well as online influence, were drivers of vaccine hesitancy in the Cape Metro. There is something we call stakeholder engagement, and the government will do well to actually engage the stakeholders. And I always say that the time to prepare for war is the time of peace. Can I say thank God for monkeypox? Because at least it's keeping vaccines and vaccination in the space. I say, and this is my personal opinion, that if vaccines and vaccination had been made endemic prior to the pandemic would have met a robustly inoculated population that, they are aware of what vaccine is, what vaccination can do, and, it wouldn't have caught us off guard. One of the things that NISH, the project, gave me the opportunity to do was in the training of NITAGs, I gave a presentation on vaccine confidence. So it's one thing for you guys to make your recommendation and everything, but it goes beyond that. What are you doing to ensure that those vaccines are actually taken up? Because like we'll say, vaccines don't save life. Vaccination does. Because the best vaccines, if it's sitting on the shelf, has absolutely no effect. You remember COVID, due to the hesitancy and whatnot, so many millions of doses had to be discarded and destroyed because the vaccines were there, they were safe, they were effective, but the people just weren't taking them and then they expired. There are quite a number of interventions that have been recommended, and one of them is to provide accurate information on regular basis. Don't let's wait for a pandemic. Now that there is seemingly nothing, because what you hear repeatedly kind of stays with you. Let's admit uncertainties, because, for example, the COVID-19 vaccine, number one, we've not seen this virus before, and I was being told, don't worry, it has no long-term side effect. I flipped. To be honest, I told the person telling me, how do you know it has no long-term side effect? The virus had not been around long enough. The vaccine is even newer than the virus. So which crystal ball did you check? Because that is certainly not science. And that's your crystal ball that is telling you that the vaccine will have no long-term adverse effect. It didn't warn you of the onset of the pandemic. So we scientists, we should be willing to allude to uncertainty. In about 2-3 years now, we will be able to have 5 years data. Then we could say, okay, we tracked the people who received this vaccine over 5 years. 99% of them are alive and well, and then the 1% that is missing, half of them died of car accident or whatnot, and show the world that is, that look, this is hard evidence.